Have you heard about patients having to manage drains after mastectomy, whether they undergo the operation with or without reconstruction? If you have, please enter a comment about your thoughts on it. Does that make you concerned if you have to make a decision regarding breast cancer surgery? Well, I've got good news. There is a safe way to avoid this completely. Watch on. Just imagine, instead of anxiety about drains, a patient could be free from having a tube emerging from under the skin. Imagine not having to carry a bag with bottles in it. Imagine walking around without having to be constantly thinking about measuring the volume of fluid collected. So if you feel that freedom from all these concerns is a good idea, please let me know in the comments section below. All these things can be a reality for the majority of patients undergoing surgical treatment for breast cancer. How, you may ask? How can this be the path for most women who undergo breast cancer treatment? By choosing the right operation. As this information is intended solely for patient education, I urge you to see your doctor for treatment planning. Before venturing into the options for breast cancer surgery, let us first discuss the prerequisites for this treatment solution. Women who have cancers which are 3 centimeters in size or smaller preoperatively are especially suitable. Downsizing a larger tumor can be possible with medical treatment given before surgery. In order to undergo this solution, patients should be eligible for radiotherapy. It should be borne in mind that women with certain genetic variants like BRCA1 or 2 or a strong family history of cancer may not be ideal for this solution. So what is this treatment solution? Here is a picture of the appearance of a patient who has undergone this form of operation. It is breast conservation treatment with sentinel lymph node biopsy. In case it is not obvious, the breast scar is shown by the light arrow, and the dark arrow shows the scar through which sentinel lymph nodes in the armpit or axilla were removed. This patient did not require drains when she had her surgery and has been cancer-free for close to a decade. You probably already know that there are 2 broad categories of surgical treatment for early breast cancer. The first group comprises breast conservation treatment, where the cancer is removed together with a circumferential rim of normal breast tissue. The uninvolved tissue that is preserved is usually treated with radiotherapy later. The second broad group of surgical treatment involves mastectomy, which is the removal of the breast. Women may choose to undergo reconstruction after. The removal of the breast leads to a large space under the skin that previously covered the breast. This leads to a production of fluid as the body works to heal the tissue breach. Drains are placed under the skin to remove the fluid as it accumulates so that it will hasten the attachment of the skin to the underlying muscle. If there is a failure of timely fluid removal, a persistent collection of fluid under the skin can form that lasts for years. So drains are important in the healing process after mastectomy. Drains are also used if reconstruction has been performed. The ends of the drains are connected to bottles, which collects fluid that comes through the tubes. The bottles used usually have a capacity of about 200 milliliters to make it convenient to carry around in a small bag. However, this limits the amount of fluid it can contain, and patients may have to empty it from time to time and record the volume of discharge. The fluid volume helps doctors decide when the drain can be removed. This is usually done when daily drainage reduces to less than 20 milliliters. In summary, there is a lot to manage in the few weeks of recovery after mastectomy with or without reconstruction, when drains are inserted to aid with wound healing. I have observed that on social media, many patients have posted concerns about limited mobility, challenges in sleeping position, the need to keep a log of fluid volume, basic hygiene like showering, and potential for complications. I actually have a suggestion on how patients can avoid all these anxieties. It is to choose an operation if her condition allows, which does not require drain care. If a patient chooses to undergo mastectomy, a drain is very commonly used whether or not reconstruction is performed. So one way to avoid the need for a drain would be not to choose to undergo a mastectomy. As we discussed earlier, if a patient fulfills the following criteria, she does not have a high-risk gene variant for recurrence, or a strong family history of breast cancer, if she is eligible for radiotherapy, if the size of her cancer pre-operatively is no larger than 3 centimeters, and there is no evidence of spread outside the breast, then she may wish to consider breast-conserving surgery with sentinel lymph node biopsy. This surgical combination does not require the use of drains, and it will spare a patient all the concerns of managing a drain for weeks after surgery. This is an illustration of the scars associated with breast conservation treatment with sentinel lymph node biopsy. In this case, the patient had a radial incision with the scar indicated by the light-colored arrow and the scar for the sentinel lymph node biopsy indicated by the dark arrow. This is another example of a patient who underwent breast conservation treatment, with the scar from cancer removal highlighted by the light arrow and the scar through which sentinel lymph node biopsy was performed highlighted with the dark arrow. Since there were no drains used, these patients did not need to be concerned at all with drains and could care for themselves as usual from the day after surgery. They could perform all activities of daily living but were advised to refrain from strenuous activities for about 2 weeks. Patients may now ask, drains are not the most important issue? Cure rate is. Doesn't mastectomy offer the best cure rates? Well, let us look at research data. Survival outcomes are often used as surrogates for cure in medical research. This is a meta-analysis comparing breast conservation treatment with mastectomy. A meta-analysis is a statistical calculation of the combined data from multiple studies which fulfill certain stringent criteria. In this study evaluating a total of more than 1,800,000 patients, it was found that breast-conserving surgery is associated with improved overall survival compared with mastectomy. We can interpret this data to say that breast cancer cure is better with breast conservation treatment. What about local recurrence, or cancer returning in the breast? Does it not make sense that removing the entire breast will prevent recurrence in the breast? While that question may be intuitive, research shows that there is no difference in loco-regional recurrence, abbreviated as LRR, in this 2021 article. As a surgeon who wishes to offer the best evidence-based surgery, I would advise my patients based on research data and not just intuition. This team of researchers found no difference in recurrence rates between breast conservation and mastectomy. It is therefore not surprising that an expert panel that convened at the 2025 edition of the St. Gallen International Breast Cancer Conference stated their belief that patients should be advised that breast-conserving surgery and radiation therapy is usually the best treatment option with comparable or superior cancer control results. There is also less morbidity and fewer complications. Morbidity refers to problems after surgery. The absence of drains after breast-conserving surgery may contribute to fewer problems and complications. In summary, if breast conservation surgery is performed with sentinel lymph node biopsy, no drains are needed. In addition, there is no compromise in cancer control when compared to mastectomy. So where appropriate, performing breast conservation treatment avoids the need for drain care and the anxiety that comes with it. This allows women to live more in the immediate post-operative period. Thank you for staying until the end of the video. It is my hope that in sharing robust research data and post-operative pictures of patients treated with breast conservation, more women would consider it as their surgical therapy. The references cited as evidence are provided with the specific intention to enable you to fact-check and verify them. If you have found the information useful, please like, share, comment, and subscribe as signal for more such content. There are many topics on breast cancer surgery which are discussed in other videos on this channel, and I hope that you will join me there too. Until we come together again, take care.